Welcome back. Local on 2 is celebrating Wellness Wednesdays and helping you feel better by addressing a variety of topics. Today, we're talking about hormones and weight loss.
Yes, Sylvia Castaneda wanted to learn more about the impact of these changes on both women and men. She sat down with doctors from Inspire Medical Wellness in Mount Juliet and Evexia's Health Solutions for insight.
I think we all know someone on GLP-1 medication for weight loss management, but not everyone has the same results or responses to these medications. So I'm so excited to have back with us Dr. Jason Burchard, who is the owner of Inspire Medical Wellness right here in Mount Juliet, and Dr. Terry Denai, who's the founder of Evexia's Health Solutions. So glad to see you both again.
Yes.
Fun to be back.
Yeah.
Well, let's talk about these medications.
Yeah.
Dr. Burchard, let me ask you this. What do you do when you focus on a weight loss program for your patients? And basically, how does hormone replacement therapy involved in that?
It's a great question. And, you know, it's interesting. The very first thing that we really discuss with our patient when they come in is the importance of making sure that they understand our goal is not just to get weight off them. Our goal is to get weight off them, the weight off of them in a very healthy and a very sustainable fashion. Because think about it, what's the point of getting weight off if you can't keep it off? And we really drive that point home because statistically speaking, most studies show about 90% of the time, the weight that a person loses, they just eventually gain back. Yeah. But a primary problem or reason why that happens all too often is they're failing to address the root cause, meaning as important as your diet is and your exercise and even these fat burners like GLP-1s, they all play a role, but none of those can really fix or overcome an unhealthy aging metabolism.
Oh, that's good.
And that's because your metabolism is ultimately what's going to decide. Are you going to burn or store what you put in it? And your metabolism, back to your second question, is very hormone-centric. There is a plethora of hormones that really ultimately determine how you're going to metabolize what you put in. So it's very important that we understand and we test the metabolic hormones while we start to get the process of getting the weight off.
Yep. Well then, Dr. Denai, let me ask you this. In what ways do you see maybe healthcare providers falling short when prescribing these very popular GLP-1 medications? And how do you as a doctor overcome this?
Yeah, see, and I think he just made a really great point. I think the biggest way is, again, we're utilizing these medications in the same, I've said it before, allopathic way, meaning you have a problem, here's a temporary solution, rather than fixing the root cause and addressing everything that's deficient. I think one of the big places that is falling short with these GLP-1s, they're just being prescribed like another medication without addressing lifestyle, hormones, testosterone, thyroid are both metabolic hormones. So if you don't address those deficiencies, you may get the weight off initially, but keeping it off in the long term is really a problem. And the other problem that we're seeing with these medications is people are losing a lot of muscle along with their fat, or more muscle than fat, and that is where testosterone plays a huge role in maintaining that what we call lean muscle mass.
Sure.
This totally makes sense. Well, then let me ask you both this. Because of the way that you approach weight loss, what are some of the hurdles that maybe you have overcome in your practice because of the approach that you take?
Well, I think the biggest hurdle and what we really caution patients on when they're taking these medications is, to her point, is it's the trap that so many people fall into. When you just do that medication, when you're not making the proper dietary lifestyle choices, when you're not pairing it with a healthy metabolism, then again, the majority of these patients, the weight that they're losing, unfortunately, a lot of that is muscle, unbeknownst to them. And the biggest problem is then when they stop doing their weight loss therapy, when they stop those medications, not only are they going to gain their weight back, they didn't really ever fix anything, but where it gets worse is they replace all that muscle loss with more fat mass. So their body composition is really going backwards. So we just caution patients, we tell them GLP-1s are great if, again, they are coupled with the right dietary lifestyle and if we are correcting the metabolic dysfunction.
Absolutely.
And what about you with training doctors on this?
Well, there's so many things I could say about that, but one of the things that is really important is to make sure that you are going to a clinician that is comprehensive and looking at everything. The thing that makes me nervous is there's a lot of pop-up weight loss clinics and telemedicine weight loss clinics that I'm just like, how can you get a really good assessment with doing something, telemedicine? I have a little bit of a problem with that because one of the biggest things is getting a body composition analysis. When you start those GLP-1s, how much of your weight is muscle versus fat versus bone versus water, so you can track over time, are you losing fat mass and not losing lean mass? So that's a big thing we train on. And then of course, understanding and explaining to clinicians that these medications don't come without dangers. You have to be really careful, especially if you have a patient that's on blood pressure medicine or other things that maybe that needs to be altered as they lose weight. A lot of patients can come down on their blood pressure medications. We've had patients unfortunately visit the emergency room because they weren't paying attention to blood pressure medicines and now they lost all this weight and their blood pressure dropped. And so they really aren't benign medications and patients need to be monitored appropriately.
Doctors, always such great insight on what is trending right now in medicine, and I so value you spending time with us here on Local On 2 and educating us on the subject.
Thank you. Thanks for having us.
Thanks.
I'm going to send it back to you.
All right, thank you, Sylvia. To learn more about weight loss and hormone replacement therapy, visit inspiremedicalwellness.com, or you can visit Evexia.com or call 615-249-4184.